Okay, good evening, everybody, and welcome to the fifth installment of the SEIU-UHW COVID-19 update live stream broadcast. Unfortunately, I think people will realize that because the Facebook platform is being used at unprecedented levels, for technical reasons, we weren't able to be able to stream this live tonight, but we're obviously going to record this and make it available for people to see over the coming week. Again, we're excited about the substance and the information and the content of what we're going to cover tonight. We have three guests with us. One is Congressman Ted Lieu from Southern California, who I'll introduce a little more extensively in a moment. And we're also joined by two UHW members, John Portez, who's employed by Kaiser in Southern California, and Ivan Ipez, who's employed by Dignity at Northridge Hospital in Southern California. So I'd like to give John and Ivan a chance to introduce themselves right now, and then we'll tack back to the other parts of what we want to work through. But John, why don't you go ahead and introduce yourself?
Yeah, thanks, Dave, for giving me the opportunity. My name is John Portes. I work in Kaiser Permanente in Downey, and I serve as one of the executive board member for our union UHW. Thank you.
Great. And what do you do, John?
I am currently a lift tech. We service ICU patients. Normally, basically became just, the COVID-19 ICU for our facility.
Great. Terrific. Thanks for being here. And Ivan, how about yourself?
My name is Ivan Yepes. Thank you, Dave. I've been working with Dignity for about 14 years now. I work in the admitting department, and I'm very happy to be here, actually, given this opportunity.
Terrific.
Thank you.
Nice to have you, Ivan. So we're going to come back in a few minutes to both John and Ivan to talk more about just what they're experiencing out there in their institutions as a result of the pandemic and everything we're contending with. Before we get to that, though, we are really privileged and honored to have a member of the United States Congress with us. And as I said a moment ago, we're joined this evening by Congressman Ted Lieu from Southern California. I'll let him talk a little bit about his district and his connection to us. But one of the things we've intended to do through the course of these different installments is we want these events to be a place where people can come and get information that they wouldn't otherwise be able to get, to hear from experts, whether those are epidemiologists or scientists or political experts, such as members of the United States Congress. So without further ado, I'd like to ask Congressman Lieu to introduce himself and tell us a little bit about himself, and then we're going to talk a little bit about the CARES Act and what the U.S. Congress is doing to help lead the country through the pandemic. So Congressman Lieu, thank you.
Thank you, Dave, for your leadership and for inviting me on. I'm honored to be here with John and Ivan. And I want to thank all of your members. Many of them are on the front lines of fighting against the coronavirus pandemic, and they're putting their lives and their health at stake every single day. And I just want all of you to know that I am grateful and the people of California are grateful. I'm going to give you a quick update on the three bipartisan laws that were passed, and then I'm happy to discuss the stimulus package more in detail later. The first law we passed provided billions of dollars of funding to try to find a cure, either a vaccine or a drug therapy, because that's really the only way we're going to get out of this pandemic. Second law we passed provided important provisions for people to get emergency paid leave, and it also provided additional funding for testing. And then the stimulus package that was passed provided a lot of relief to Americans across our country who are suffering the worst economic effects of this outbreak, including over $100 billion to hospitals and $1 billion for personal protective equipment. And right now, there is a holdup in Congress. We're trying to get additional monies out for small businesses, which is great, and I support that. But Democrats also want to put in an additional $150 billion to go out to hospitals, hospital systems, to really address everything that many of your members are having to face on a daily basis.
Great. So, Congressman Lieu, what you just referenced, and I think many of us have seen some of the news reports lately about the fourth bill that's now starting to get discussed in the Congress. And as you just alluded to, the potential for specific provisions that would aid frontline healthcare workers, and, including, basically what you might call bonuses or supplemental payments, but something to really acknowledge, the work that members like ours are doing. We saw today in the news that, once again, there's a bit of a loggerhead effect going on in the United States Senate. Can you give us your sense of, what are the prospects for that legislation, moving through the Senate and the Congress and ultimately being signed by the president?
Thank you, Dave, for that question. Let me just take a step back and talk about another provision that many people will get, which is the stimulus checks. So if you make $75,000 or less in adjusted gross income as a single filer, you will get $1,200 and then $500 per child. If you're married, then it's $150,000 in adjusted gross income. And then that goes up to basically $99,000 per adjusted gross income. You'll get a prorated check. And if you are married and have $198,000 or less adjusted gross income, you also get a prorated check. So many people will get that assistance. There's actually two bills being discussed right now. So one is going to be a second round of stimulus, similar to the CARES $2 trillion package. I've long been saying that the initial stimulus was too short and too small to deal with the actual crisis we're facing. At the same time, there is a very quick interim bill that Congress is trying to pass that's going to get an additional $250 billion out to small businesses, which again, I support, but Democrats believe that many people are hurting. And so we are fighting to get an additional $150 billion out to also hospital systems and to make sure that we can have the personal protective equipment that we need. There's also a regional problem. As all of you here know, in California, $1,200 may go somewhat long in Alabama, but much shorter here. So one way to try to fix that is either to have a regional bonus, if you will, or we could look at other provisions that have negatively affected states like California, New York, and others, such as the SALT tax cap. If we could remove that cap on a SALT deduction, then people in California can take the full deduction for their property and state income taxes. So we're working on different ways to help Californians. And then specifically on healthcare workers in terms of bonuses, let me raise that issue and see if we can get it. We're unfortunately having to deal with Republicans in the White House, and it's just something that we have to fight and battle every day.
No, I appreciate that, and I appreciate you going back to mention the earlier legislation that was adopted as part of the earlier stimulus plan and the $1,200 payments in the way you laid those out. I know, first of all, I think it's important that those payments, as I know you're aware of, will affect the vast majority of UHW members and frankly healthcare workers generally in California. Can you give us a little bit of insight? I know people will want to know, when should they expect those to arrive? Is receiving those contingent on getting your taxes filed? If you could talk a little bit about the mechanics of that, because that is something that will apply to the great majority of our members.
That's a great question, Dave. So we've been told by the Treasury Department that people who have a direct deposit account should start getting these checks next week. If you don't, there's going to be a delay to get a physical check, or if you have to sign up for direct deposit. In addition, they're going to look at your 2019 or 2018 tax returns. So if you, for whatever reason, have not filed a tax return, you should you should file one in order to get the stimulus check. And I just signed on also to a letter that Representative Espy out in New York is leading. Unfortunately, people who have the ITN number are not going to be able to get a stimulus check. So we're trying to fight for that as well. Again, we've got to overcome some Republican obstructionism, but I believe people should be getting these stimulus checks whether or not they have a Social Security number.
Okay. And so just so to make sure we're being crystal clear with people, your advice, your recommendation for people to get the best chance to get the stimulus checks quickly would be to have a direct deposit bank account and to have your taxes filed. If you haven't filed for 2019 yet, let's get moving on that and get it done. And the combination of those two things makes it more likely that people would get the check sooner.
That's exactly correct. And if you have a family member who is on SSI or Social Security, and they don't actually have to file taxes, we fought to say that, look, it'd be weird for them to do it. So those people will simply get the stimulus check. But for everybody else, if you haven't filed your taxes, you should do that. Yes.
Okay. So something else that, you mentioned PPE and how the Congress was.
Dave, I don't want to be confusing. This is for your 2018 or 2019 tax year. For this tax year, the IRS has actually extended the deadline. So you don't have to file your current taxes right now in order to get the stimulus check. This is talking about your taxes from last year and from 2 years ago.
Okay, terrific. One of the things you mentioned in your earlier comments, you raised the topic of personal protective equipment, PPE, which is something that we've all been concerned about, we're all thinking about. And one of the things that this coronavirus pandemic has made clear is that our country, did not have the supplies necessary to really get us through this. But the other thing is we lack the domestic manufacturing capacity to produce this quickly. And so I know among our members, right, there's plenty of people who have had discussions recently about this is a national security issue, is being able to be self-sufficient in a pandemic situation. Any thoughts you might have or how the Congress might look at that in terms of being more self-sufficient in the future on manufacturing our own PPE?
Thank you. Who would have thought that we actually need masks and gowns rather than ammunition in this latest war? And that's a great point you raised. For weeks, I and Congressman Levin out of Michigan, we wrote letters to administration asking administration to invoke the Defense Production Act, which is a law that Congress has actually reauthorized over 50 times, precisely for issues like this, where we are facing a national emergency and the president can get manufacturers to retool their factories to start building items that Americans actually need. For weeks, the president resisted that for whatever reason. It's not clear to me why. And then he finally invoked it basically last week, but then he's been using it sparingly. So that's one way we're trying to get this done, is to get the executive branch to start using the Defense Production Act much more aggressively to get existing factories to start making personal protective equipment, ventilators, and other items. And then for the long term, we have to look at simply having domestic manufacturers make these masks and gowns, because it's pretty clear to me that we don't know when the next pandemic is going to hit. We already had SARS, we had the swine flu, we've had other viruses that were not as contagious or lethal as this one in combination, but there's no evidence that this couldn't happen in 5 years, 10 years, or so on. So we need to absolutely have, as a national security matter, domestic manufacturing for these critical items.
So in that vein, can you, we've heard also just different news accounts and monitoring the press, obviously being here in California, there's been some discussion about Tesla, Apple, other companies that might have the ability to produce, different things, whether they're ventilators or medical supplies. Do you have any insight that you can share with us on what companies with manufacturing capacity inside of California might be considering or might be able to do to address the problem we just talked about?
I don't have insight on specific companies, but that is a good issue. So we will look into it and then we'll get the information to you. I do know that because of the lack of a national federal supply chain and a lack of a single source, you have this problem where you have different states bidding against each other, jacking up the prices for their PPE. You have hospitals bidding against other hospitals. It is a very bad way to do this. So we're, again, trying to get the administration to have a single source, because not only are these prices being jacked up, but also it's not efficient. You don't actually want places to hoard this PPE and ventilators. You wanted to go to places that actually need it right now. And so if we could have a much more rational distribution system, that would make it much better. In the meantime, unfortunately, what my office has been doing is we've been getting requests for getting some of these PPE items unstuck at airports and at customs places. We were able to have some success in getting some PPE unstuck, but if anyone has this problem, please let me or my office know and we'll work on it. And the agencies, to their credit, have been very responsive in trying to get the PPE moving. Sometimes it just takes a call from a member of Congress to have that happen.
Great. No, that is something we might well take you up on, because our sense is that it feels a little less scary this week than it did a week or two ago, but we're still dealing with shortages. Our members across the state, it's an issue that is top of mind for everybody who's going into healthcare facilities right now. I do want to share with you, just as a way to convey, what we're contending with is, we're encouraged. We don't want to overreact and or jump the gun, but the data coming out in the last day or two gives little glimmers of hope that, in California and perhaps some other places, that the rate of the spread of infections is slowing just a little bit, and we have to see if that's going to be maintained. But other issues as we go forward, we as healthcare workers are working on the assumption that we're going to be in these conditions for the next 2 to 3 months at least. And one of the issues that's becoming very, very prevalent is it's been reported in California that 10% of those infected in the state are themselves healthcare workers. And many of our members are, not wanting to go home after they work because they don't want to expose their families. And I know that just before we got started, John Portes, was talking about this. And John, if you could comment on that. And so, Congressman, again, any thoughts you might have, but that we just want you to know as a leader in Congress, how this issue of our frontline workers being fearful, and how do we get through this over the next few months. So, John, can you jump in on that?
Yeah, thanks, Dave, and thank you, Congressman, for that update. So we actually, I work in ICU unit in my hospital, and that hospital just become converted into a COVID positive unit. So alongside with my RN counterparts, we're scared because, we don't know when our PPE is going to run out. And we talk among each other, like right now I'm isolating myself from my own house, so that way I don't give it to my 5-year-old and my 1-year-old. So this is the constant fear of every healthcare worker that we're dealing with in my facility, and I think throughout statewide. Thank you, Dave.
Thanks, John. And Congressman, something that we'll just make a suggestion to you, and I don't know if you'll have a reaction of any sort, but if we're going to get through this pandemic, millions of healthcare workers like John around the country who understandably don't want to expose their families to what they're dealing with at work, the issue of temporary shelter is becoming a much larger and larger issue, and there's starting to emerge examples of hotel chains, that are helping to take up the cause and take up the challenge of providing free or discounted housing for healthcare workers. And so as we're thinking about a fourth stimulus package, obviously the hospitality industry and the hotel industry is really suffering with the changes in our country from the past few weeks. And just wondering if you have any thoughts on maybe part of the stimulus being a twofer, which is how do we support the hospital or the hotel industry at the same time that we try to work out a situation where frontline healthcare workers can avail themselves of temporary shelter so that they can continue to do their work without exposing their families. I don't know if you have any thoughts on that, but we'd love to hear it if you do.
So first, let me say thank you to John for what you do in taking care of people in the ICU and for risking your health to do that. So I appreciate it. I'm really glad you raised that issue because I actually hadn't thought about it until just now. And so thank you for pointing that out. It hadn't even actually occurred to me where healthcare workers were staying when they were no longer at the hospital. So I will raise that with leadership. I think it could actually be a twofer to also help out the hospitality industry that is getting whacked very hard with this pandemic. And so I think that's a good idea. So let me look into it. Thank you for letting me know.
No, we appreciate it. And just so you know, we certainly can provide you with examples of our members like John, like Ivan, like others, who right now, many of whom are literally sleeping in their cars because they don't want to go into their homes when they return, or they're sleeping in their garages so that they don't, have contact with their families inside of the house. And we're about a month into these conditions, and if we have 2 or 3 more months to go, it really becomes a critical issue about how do we sustain the workforce over a longer period of time so that we can, fully eradicate the virus. But thank you. And if there's anything we can do to be a resource on that, please feel free to get a hold of us, and we'd be happy to do that.
Actually, if you could send me in writing some of their stories, I think that would be helpful to make the case.
Absolutely. So let me just raise one more issue with you, and something that again has just exploded in the past 10 days or 2 weeks. So we're now at the point, because of the fallout from the pandemic, as you know, over 2 million Californians have now applied for unemployment benefits, 17 million Americans generally, and we're not sure where the number peaks. And so literally these are numbers we've not seen in 80 years since the Great Depression. How are you and your colleagues, beyond the obvious about unemployment benefits are critically important, but what can you share with us about how just the scale of this is being thought about in the US Congress?
So one of the items that Democrats fought for was to expand unemployment insurance. And some of you may have seen that their CARE stimulus package was actually delayed a little bit because some Republican senators were opposed to unemployment insurance expansion, but we were able to get that through. Essentially, we got an additional $600 per week for unemployment insurance for 4 months. To me, that's good. I still think it's not enough. So we're going to look at further expanding unemployment insurance in the second CARES package. We also have to give states funding to now handle the additional claims. It's a capacity issue where you have just overloading of these employment offices. And so we need to give states some additional resources so they can hire personnel to handle all these claims. But we are facing an astounding number of unemployment insurance claims. And that's why I believe that we absolutely need a second stimulus package, and we're going to look at further expanding unemployment insurance.
Okay. Well, we certainly agree with you. And, everyone here in California, before the pandemic hit, we were talking a lot about the housing shortage, the cost of living, and all of these problems are only going to be intensified and magnified. And, nobody has ever experienced, what does it mean when this many people lose their jobs in terms of paying the rent, paying the mortgage, all of that. And so we appreciate your efforts, everything you've done so far, and to continue to work on this going forward. So on behalf of all of us in UHW, we just want to thank you for being with us here tonight. We're going to turn to some of our, kind of like our nuts and bolts, but I want to give you an opportunity, any closing thoughts you might have to UHW members and friends and family who watch this every week.
So let me again thank all of you for what you do. Many of you on the front lines of fighting the spread of COVID-19 and treating patients who are infected with it. And you're putting your lives and your health at stake. We are all so grateful for you doing that. And we absolutely need to make sure you have the PPE that you need to protect yourselves. And I've learned a lot from this meeting, especially about the fact that some of you are not going home because you don't want to infect your family. So let me look into that issue and see what we can do to help you out with that. And I do want everyone to know that local, state, and federal officials are working closely to address this as fast as we can. And there is still a lot of cooperation. And at the end of the day, we're all Americans and we will prevail.
Great. Well, thank you, Congressman. Really do appreciate it. And we'll definitely follow up with you on the things that you were asking for. So thank you again. And thanks for everything you've been doing.
Great. Thank you, Dave.
Great. So now I want to, part of what we do in each one of these broadcasts is we try to give people an update and a report on just the activity in the past week. And frankly, we have an enormous amount to report on tonight. Before we get into the particulars, I want to give Ivan and John an opportunity just to give their own comments or reflections on just what the last week has been like. And let me just sort of set this up before I ask for their thoughts. The first time we did this, we were really focused on the science and, how the virus was transmitted and that kind of stuff. That was the first two installments of our broadcast. And then we were talking about, just how do we deal with the shortage of PPE and how do we, combat that when it really looked that there were some dire situations around the state. And then as we've gotten deeper into it, we've started to deal with some of the larger policy questions, how we deal with our employers, what state government, what national government is doing. And all of this evolves week to week. And it seems, like the world is very different every time from week to week. But Ivan, if we could start with you, just as somebody, working in your institution at Dignity, just the basic thoughts that you're bringing to this broadcast tonight. What's on your mind? What's on the minds of your coworkers there at Northridge Hospital?
Thank you, Dave. It's been a very rough experience, although now we seem to have a bit of a routine now. In the beginning, it was very, we got off to a rough start. There was no processes set in place at the hospitals. So that was a bit of a problem until processes were set in place. Then, of course, like you had mentioned, there was a supply problem with the PPEs as well as the masks. Our employer didn't want us to use masks. Well, not everybody. Certain departments were not supposed to use them, but that has changed in the last week and a half to two. Of course, the union had a lot to do with changing that. And we're very grateful for that because they didn't want, then again, we understand that there was a shortage of supplies. That has been, to some extent, overcome in the last few weeks, the last 2 weeks, actually. We just heard, for my hospital, we just had a big supply of PPEs as well as masks. So that, I think, has been resolved for the next couple of weeks. Our next problem is that there's been a lot of flexing because of the fact that the emergency room, I work in the emergency room. Of course, I don't have direct contact with any COVID patients, but I know that they're there. There's been a lot of flexing because of the census, low census. So we're right now trying to resolve that, and in negotiations of maybe a hazard pay, or trying to help some employees that don't have any PTO and yet they cannot be flexed. So we're doing that. Also, there is daycare that in my hospital that they're trying to, they're gonna actually, they signed with the city of LA for their facilities, to use their facilities for daycare for employees that need or cannot work because of there's no schools now, so they were having difficulty working, or they were in conflict with working and taking care of their family. It's something that we've never gone through in our lifetime, and certainly it has an impact in our lives. And we're just, or I'm going day to day, basically, because of the fast-paced changes day by day, and trying to make adjustments in our own lives. And it's hitting hard, not only emotionally, but economically. But like the congressman says, certainly we will overcome this. And that's
Great.
We all hope that, for everybody's sake.
Great.
Um,
All right. Well,
Thank
no,
you.
you teed up a whole bunch of topics, Ivan, that we want to touch on. And before we, I'll try to keep a mental note on all of the different subjects that you ticked off there, and we've got news to report on, I think, just about all of them. But John, before we get to that, I want to give you an opportunity, just in the same vein, what's on your mind, what's on the mind of people in your facility?
So like what Ivan says, like it looks like the industry this has become a synonymous feelings for every healthcare worker about when is the PPE is going to run out and how they going to maintain cross contamination with their loved ones. This has just become apparent. To tell you the truth, like all my coworkers, they're coming to work with dignity, but they're worrisome in the sense that they might get the virus. So this is just becoming more reality, living in your own, I would say, worst nightmare.
Okay. No, I appreciate, and we were talking before that you yourself are isolating at home so as not to expose. You have 2 young children, and trying to protect your family and keep them safe. And we just hear from members up and down the state, how many people are taking measures like that to protect themselves. So I want to begin this evening in terms of just a basic activity report. The first thing that I want to share with people is something that we started to announce today across the whole of Kaiser Permanente. And as people know, John is employed at Kaiser. It's our largest employer. And yesterday, we finalized an initial agreement that really speaks to 3 topics. And I think Ivan touched on all of them, and John has alluded to them as well. The topics are childcare, temporary housing or temporary shelter, and then additional leave for people who are exposed or have vulnerable family members. And I want to preface this by saying we've reached this agreement with Kaiser. It's going to be rolled out over the next couple of days. We think it'll be fully operational by Monday. But I want to say to the folks in our hospital division, including those at Dignity and Sutter and Tenet, we're in discussions there as well. And we frankly want to take this agreement and then seek to get it copied or replicated for our other major healthcare systems. And I mentioned Dignity, Sutter, and Tenet. There's conversations going on beyond those, but those are just the next set of large ones. So first of all, what's now been agreed to is that at Kaiser, all Kaiser members, full-time, part-time, on-call, per diems, who are working 20 or more hours a week will be eligible for a $300 a week childcare stipend to offset the cost of childcare. This is for people who are going into facilities, and it's $300 for full-timers. It's prorated, for part-timers and on-call folks working less than 32 hours a week, but the minimum benefit is $210 a week. That benefit will be available to Kaiser employees retroactive to April 1st and going forward until May 31st, where we will reevaluate where we're at, but that date also corresponds, basically with the end of what would have been the school year, although we all know that school has been canceled across the state. So that's an important benefit, again, for everybody going into work at facilities, full-timers, part-timers, on-calls and per diems, 20 hours or more, minimum benefit of $210, maximum benefit of $300 a week. By the way, I should say this is something that can be used to pay for childcare. If you have a neighbor, if you have a family member other than your spouse who's doing the care, or if you're using a facility of some sort, that you have to, fill out a form and basically, explain how it is that it's being done, but the benefit covers a whole wide range of caregivers. Second thing, and we talked about this to the congressman, and what we've heard loud and clear on this issue of temporary shelter and people who are increasingly worried about going home and exposing their families, is we've reached an agreement with Kaiser that will give folks the opportunity to be able to be housed in hotels. We know that the Marriott and the Hilton chains are participating in this program, that Kaiser was working to identify hotels within a 5-mile radius of all of their major facilities. People who are working, long hours, who don't want to travel home because they might be returning to work the next day. So folks who are really doing a lot that way, or if you have vulnerable people in your family at home, and that we're going to use the CDC guidelines, that if you have family members in your household who meet a set of criteria outlined by the Center for Disease Control, you would also be eligible for temporary housing that would be paid for by Kaiser, and working it out with the major hotel chains. Again, this was announced today. There's going to be a process to go through and get this done, but it includes people who are both working long and irregular hours. It includes people who might be susceptible to fatigue because of, the inability to have longer turnaround periods, and then people with vulnerable folks in their households, and anybody who tests positive as well. So that's a benefit, and something that we hope will be taken up in large measure. I should say this benefit is not retroactive. For temporary housing, that's on a go forward basis from Monday of next week until May 31st, and then again we're going to reevaluate what the world is looking like at the end of May. And then the third thing I want to mention is what we're calling at Kaiser to be supplemental administrative leave. So this is for people who, God forbid, themselves test positive, that you're going to be, it will be available to get 80 hours of additional leave on top of whatever your leave bank is. But the leave will also be available for people who are sent home because they have a temperature, maybe they're exhibiting, one of the symptoms of the disease, but that, but where you're going to either be waiting on a test, or perhaps you won't get tested. And so we're experiencing now, there's lots of temperature testing going on in facilities up and down the state from Kaiser. And if anybody is sent home, they won't be required to use their own personal leave banks. They'll be able to use this supplemental administrative leave either to, if it takes 5 days to get a test result, you'll be covered for 5 days. If you test negative and then can go back to work, you will not have had to use your own PTO time to do that. And again, in the terrible situation that somebody tests positive, there'll be supplemental leave. I want to make the point again, this is for full-timers, part-timers, on-calls, per diems, prorated 80 hours for full-timers, less than 32 hours at Kaiser, prorated down to at least a 40-hour source of time, or a 40-hour bank of time. So that just got announced today across Kaiser Permanente. I know that this is something it was announced this afternoon. We've already gotten a lot of, comments. We're going to have information up on our website. And we're also going to seek to take that agreement to the other major healthcare systems like Dignity, Ivan. But John, I want to give you an opportunity to comment on that. I know that you and your coworkers are starting to hear about it, but just anything that you'd like to share about that.
So Dave, basically when we said that to our peers, all they think about is just like, that outpouring thankful for you for, negotiating that some sort of benefits and hopefully cascade to our other brothers and sisters in our hospital division. So thank you for that though.
Okay, no, that's terrific. A whole bunch of people worked on it. And we should also say, by the way, that the benefits that we're getting are across all of Kaiser, not just in California, but nationwide. And they apply also to all union members, all managers, the doctors. This is, a company-wide policy that, really tries to recognize, folks who are going into these facilities every day. So Ivan, I want to give you a chance to, I don't know if you have a comment or a reaction, but as we said, we want to take this to Dignity and, say, look, here's what we achieved at Kaiser. We want to, try to replicate this as much as possible at other places.
Thank you, Dave. Yes. Yeah, we would like to replicate it, like you say, with Dignity. In some cases, some of our members have not been treated pretty good, meaning that, I'll give you an example. One of my coworkers was exposed. She was told that she was exposed to a patient that had COVID virus, and she was told to quarantine, but they had done it in her PO, and I don't think that was fair. Yes, we brought it up to administration's attention, as we did, and if they're doing it to workers, some workers don't say much or just keep quiet. I'm sure they must have done it to other people too, and that wasn't a good thing. We shouldn't have to do that under our PTO if it happened there. And they did do a COVID test, and it was proved to be negative. She was out about 2 weeks from work, about almost 3 weeks actually. But I'm glad that it turned out negative. But yes, right. We're hoping that you can replicate what Kaiser has, if anything, as close as possible.
Great. All right. Well, we are getting on that everywhere right away.
Thank you so much, Dave.
And the one thing I just want to say, I've mentioned some of the big systems, but we also reached an agreement with one of our smaller hospitals and smaller employers at the Southern California Hospital of Culver City. We reached a terrific agreement today, covers a lot of these topics. And so I just want to say to UHW members, whether you're at a standalone individual institution or some of the big systems, we're working hard to try to get all of that done. I next want to just report on two things that we've had happen, one today and one last week with Governor Gavin Newsom, obviously California's governor. Earlier today, Governor Newsom participated in a town hall, a virtual town hall, similar to what we're doing right here, with 30 SEIU members, including 10 members from UHW. And one of the topics that came up is this temporary shelter issue, so that healthcare workers can be supported, don't have to expose their families. And Governor Newsom, just as Kaiser has done, the state of California is also working with major hotel chains to make hotel rooms available at discounted or free for healthcare workers up and down the state. And all of this is happening in real time. I want to encourage everybody, we've got lots of information on our website about this, www.seiu-uhw.org. And please go there. And, all of this stuff is available, and it's difficult to give every single detail on each of it. But that happened today, 10 of our members meeting with Governor Newsom virtually to talk about issues of frontline workers. A week and a half ago, we also, joined with a number of organizations in California to talk to Governor Newsom about PPE, about temporary shelter, about the need for childcare for healthcare workers. And what's good about it is, that meeting a week and a half ago turned into action, particularly around the temporary shelter that we got to hear about from the state. And Governor Newsom also announced that publicly today in his daily update to people across California. So that's something that's important. And I want to say just a quick word about childcare. We keep working with, usually municipalities up and down the state. We're in discussions with Los Angeles. We've had discussions with Sacramento, with Stockton, with smaller communities. And we've got lots of information again on the website that, if there's opportunities or examples, where we can connect our members, healthcare workers, with affordable childcare as we're going through this, that's all available. And I want to remind and encourage members to do that as well. On the topic of PPE, again, something the state of California and Governor Newsom announced either yesterday or the day before. It all blends together. But the state of California has reached an agreement to import 200 million masks a week, beginning in the coming weeks, to make both N95s and other sorts of masks available to healthcare workers across the state. Again, a topic that we've engaged with the governor about, and encouraging him to do everything that can be done in that vein. So we're going to continue to do it, but it does seem like, compared to last week and earlier times, we're witnessing the state of California getting some traction and getting some momentum on that. I do want to say at the same time, we have UHW members up and down the state who are getting things donated or delivered or obtaining PPE supplies in their local communities. I want to give a special shout out to an organization in Northern California called United Chinese Americans that has been organizing and obtaining supplies in most cases from China, but being distributed to members mostly in Northern California. And an organizer who used to work for us at UHW named Cheyenne Chen has really been leading this. And just in the last week, they've provided thousands and thousands of masks and other supplies. There's examples like that going on up and down the state. Two other quick things I want people to know about is that we formed 2 UHW-wide task forces, work groups, one of respiratory therapists to talk about issues that are specific to that job and that profession, which is really, absolutely, on the top tier of what has to be done to combat coronavirus. And then secondly, EVS workers. And so we have statewide work groups of both respiratory therapists and EVS workers, who are doing all kinds of work to connect members, to look at best practices, to make sure that we're, really doing everything we can to keep our members safe and to allow them to do their jobs in an effective and safe manner. And the next thing I want to mention, and again, just give an opportunity to John and Ivan to talk about their experience in their own workplaces, is that people know a few weeks ago we started to roll out, our intention to meet with our employers facility by facility to go through a checklist of things that ought to be getting done. And that work has resulted in all sorts of workflow changes, safety changes, the installation of plexiglass up and down the state and all kinds of employers to protect people. So many, many things. There's the command centers at Kaiser that we talked about last week on the broadcast. But we're now in the midst of doing our second checklist, which is what we're calling the surge checklist, and getting ready, for what is a wave of patients that we all know is coming. And by the way, I should say that the best estimates now from the leading scientists and epidemiologists and state government is that California the surge will hit in May. So we're still about a month away from it. And again, we're going to be dealing with this for a long time, but it's an opportunity for us to make sure that we're holding the local meetings to deal with our surge checklist. And so I just want to give an opportunity to John and to Ivan, just to talk about the level of cooperation, or, hopefully not the level of non-cooperation, but what's it like, in terms of working with management at your facility? How are we doing in terms of problem solving and troubleshooting, that kind of thing? What's the experience been like? And is there anything you'd like to share with people who are watching? So John, we'll start with you.
Yeah, thanks, Dave. So unfortunately, my facility was identified will be the hotspot as well as the LAMC. So me being involved with our facility surge plan committee. So this committee consists of facility executive leaders, clinical specialists, and labor leaders. So the essential function of this committee, basically planning out the readiness of the facility for the upcoming COVID-19 patient surge. I believe with the trajectory date of the late month of April, and that will go all the way to May. So although the recent reports of slow growth of the infection does not mean we are flattening the curve, right? So Kaiser Permanente temporarily closed outlying clinics throughout Southern California in response to surge readiness. So meaning that they're being consolidating the resources and redirecting the workforce, assets, medical personnel to support medical centers that will be impacted with the surge. So the committee plans, executes all the assets based on the forecast modeling provided by the regional surge committee. So basically each facility are enabled to convert and expand ICU beds for critical patients, expansion of medical surgical units, expansion of staffing pool, comprehensive training for the staff for safety procedures, and additional training for essential tasks for all staff. So the committee also monitored the facility census, ICU beds utilization, the care modalities, the ventilator availability, personal protective equipment.
Whoops. John, something just happened. We might be having a technical problem. I'm not sure. So Ivan, how about you? From your perspective at Dignity, preparations going forward, the level of collaboration, how's it going with working with management, troubleshooting, problem solving, that kind of thing?
Thank you, Dave. We meet every conference call every Wednesday. There is a certain amount of transparency at this time now, working together, knowing that we are partnering with them to try to resolve any issues, processes that have been set in place, and just to keep updated on the supplies of the hospital. They've opened up, and we are, there is a bridge between us and them to a common goal to for the employees as well as the patients, taking care of them as well as taking care of our employees. They are very much aware that of the community that we're trying to serve in that area, and they have opened up quite well in suggestions that we have mentioned to them, and so far we're working together to resolve the issues as we are now.
Great.
And we're happy with that.
Okay. So two things I should have mentioned. I mentioned the statewide work groups we've created with respiratory therapists and with EVS workers. And I should have included that one of the things the respiratory therapists have decided to do is they've drafted an open letter that they want to go to the management and elected officials across the state, really just highlighting what from their perspective, their voice as respiratory therapists and what they think the situation calls for and how we ought to be responding in this moment. And I'm happy to report that so far over 300 of our respiratory therapists from over 60 hospitals across UHW have signed on to the letter, and it's going to be distributed to employers and other officials this week. There was also a great story in the LA Times earlier this week that really highlighted the work of respiratory therapists and how that profession is absolutely critical and essential to combat the pandemic. And then, in terms of the EVS work group, I think we all recognize that a lot of times EVS can be taken for granted and EVS workers can be overlooked. And that's part of the reason we wanted to make sure that we were bringing some specific attention to that job and those individuals. And so tomorrow night, we're going to hold a Zoom meeting like this. Hopefully we'll be able to deal with the technical issues, but it will include EVS leaders from each of our hospitals all across UHW, all of the major, not just the major employers, but all employers, to really strategize about how we can lift up the concerns and focus on the issues that EVS workers are contending with. So last, and I always make the observation in these that the hour goes by very, very quickly. I want to, report something that's a little lighter and hopefully upbeat as a way to conclude tonight's broadcast. But, there's been an outpouring of support for healthcare workers, literally all across the world, not just here in California, but around the globe, really. And one of the things that just happened a few days ago and now is also live, and you can see this on our website as well, is that 3 food delivery companies, DoorDash, Ordermark, and Big Sunday, are working with us now. We've created a GoFundMe program and a GoFundMe account so that people who want to donate to a fund that we've created, which then will go to those companies to provide meals to UHW members up and down the state of California. And so this is something where there's lots of people out there in the public who want to support healthcare workers, acknowledge the work that we do. And so we're going to figure out how to coordinate all of that and at least get a few meals to people through a kind of a fun and an interesting partnership again with DoorDash, Ordermark, and Big Sunday. And all of this is now live. That just happened today and has gotten rolled out. So all of that represents, work that we're doing to deal with this. Again, we're a little bit heartened that there's been a very, very brief, the last day or two, just a reduction in the growth of the virus. That's been encouraging. It's too early to say that, that it's a trend, but we are hopeful for good news, but we also all recognize that we have to continue to do all of the social distancing and the shelter at home and all of the things that are going to give us a chance to get through this. So again, I want to just give John and Ivan a chance to offer any final thoughts before we sign off. I'm glad we got you back, John. We were worried that we were having some technical problems, so you're back right in time to give some parting thoughts to the folks watching this broadcast.
Right. Thanks, Dave, and sorry for that technical interruption. So what I really want to say is, that every effort that we do in the front lines to put our patient first, are immeasurable, right? Unbeknownst to all healthcare workers like myself, that the deadly capability of this virus is imminent, right? Please be an advocate to your coworkers' safety and yours, our own protection, and utmost alertness on preventing cross-contamination goes a long way, making sure our loved ones at home are safe, and God bless us all. Thanks.
Thanks. Thank you, John. Ivan, how about you? Closing thoughts for this evening?
Closing thoughts. My thoughts are just we all need to stay united in through this crisis, and remain united for all of us to overcome this whole crisis. Just stay together as a group, as a union, and then of course as a human being for the world, because this is a global thing, and we'll just remain strong. We will overcome.
Great. So thank you to Ivan, thank you to John, again to all of the members of UHW and friends and family, who are watching this, that we've really made it our mission, since this began, to be able to keep our members safe and able to effectively do their jobs. We're working in as many different areas and as hard as we can to support all of our frontline healthcare workers, all of our members who do this critical work, and we're going to continue to do so. So I just want to thank people for taking the time to join this broadcast again. We're going to continue to do them every week. Hopefully Facebook figures out their technical issues, but whether it's live or whether people can watch it afterwards, we're going to continue to hopefully make this a source of good information, updates, and connect dots for people across UHW. So thank you everybody for joining us, and we'll talk to you next week. So good night.
Thanks, Dave.
Thank you, Dave.